So we have original Medicare versus Medicare Advantage. Original Medicare has an 80/20 coinsurance. The Medicare supplement option, we're going to talk about that first. You have Plan N. Plan N would give you as of 2025, a $250 deductible. After the deductible, you have a $20 copay at specialist and primary care doctor, and you have a $50 copay at the ER. After that, the one thing that you have to note with a Medicare supplement Plan N is that excess charges are not covered. Excess charges is the hospital or the doctor's office. They have the ability to charge 15% above the Medicare approved amount. Now, what we've learned is that this is extremely rare. In fact, let's say 95% of doctors, we'll say of networks, do not participate. So what that means is they accept what Medicare pays them. So if Medicare says, we're going to give you a $500 allotment, this service is $500 worth of work. That doctor can say, that's not at all what I'm charging. I'm going to charge an extra 15%. The Plan N would not cover it. Plan G would. So Plan G, the only cost, $250 deductible is the only cost. It covers everything after. So you would have no copays, you would have no 15% excess charges, none of that. Now, another one that a lot of people talk about is a Plan F. Zero costs associated with the Plan F. I remember when I was a child, I would hear my father talking about Plan F, Plan F, Plan F. It was the only thing really available. So I remember that, and I remember it well. Plan F was the Cadillac of plans. There was no cost associated with it. No copays, no deductibles, nothing. You pay the premium and everything's covered. So he sold a lot of Plan Fs, so zero cost with it. However, it was discontinued after January of 2020. If Part A or B is effective before 1/2020, you can get it. That's the only way. Now, one other thing we're going to talk about is we're going to talk about high deductibles. I like the idea of high deductible Plan G. It has roughly a $2,800 deductible. And after that, everything is covered. And you may ask yourself, why would you get a $2,800 deductible when you could get a $250 deductible? Well, a high deductible Plan G is very, very low cost. You're looking at probably $40 per month, as opposed to with a regular Plan G, you're looking at, we'll put it up here. Regular Plan G, you're looking at probably, it depends on the area. Every area is different. That's what's really important about this, is getting in touch with me or one of my agents. You have to make sure. That you got to compare the options in your area, right? So I can show you. So if you live in, we will look up, let's see, zip code. And actually, I know a zip code. We'll use Mississippi as an example. Oh, wow. Okay, wow. Okay, so never mind. I was going to quote it for you, but there's an error on that website, so it's unfortunate. But I've been doing this a long time. I've got a lot of experience. Your regular Plan G, it depends on where you are. You're looking at, between $90 and $200. Doesn't matter. Really, what matters is where you are, your location, your zip code. So yeah, it could be upwards of $200 a month. And then that high deductible G, no matter where you are, is going to be around $40 a month, or 50 at the most, 60 at the most. But I've seen the high deductible G's in every area. They seem to be roughly the same price.